First of all, I want to introduce myself for those who haven't been to these conversations before. My name is Rich Joseph, and I get to serve as the medical director at the Center for Community Wellness at Sportsman's Tennis and Enrichment Center. And the center really seeks to promote healthy living and chronic disease prevention and in the communities of Dorchester, Mattapan, and Roxbury specifically. But one of the benefits of doing a lot of these sessions virtually these days is that more folks are able to join from sort of all over the place. And we've had people from different states and people even in different countries for some of these conversations. So it's been pretty cool to see. And so I always like to, before we get started, just put in a plug for the Center for Community Wellness and a lot of the conversations that we host. And I'll put the website for the CCW in the chat, just as something that people can go to and to stay up to date on upcoming discussions and programs that we're going to be hosting. And some of them are around sort of more medical topics like this one, others around community specific issues and issues related to COVID, obviously, and things like that. So please check out the website. And so, with that, I just want to welcome folks to this May 2021 Community Convo. And I had the privilege of hosting this sort of ongoing series of conversations between, various professionals, with some clinicians, some academics, some community members and thought leaders, and bringing them to all of you to discuss important topics and pressing issues at the intersection of medicine, health, race, politics, challenging issues. And so it's fun to host these dialogues. And they're meant to be a dialogue. And so my hope here is that people engage in the conversation, and I'll tell you sort of how to do so. For more on these community convos, I'm happy I'll put that in the chat too, because we have a variety of ones that we've hosted already. And the recording of this will be posted for people on the CCW's website. And so tonight, tonight's community convos, let's talk about lupus, autoimmune diseases specifically. And I think, a recent survey conducted by the Lupus Foundation of America found that over half of Americans have never even heard or, really know next to nothing about lupus. And so it's actually quite a prevalent condition, and May is Lupus Awareness Month. So I'm really glad to be able to bring this conversation to all of you in the month of May. It's very timely, especially with this group of all-star guests that we have, and then I'll introduce in a few minutes. So just before we get into the conversation, I just wanted to, just a few quick housekeeping items is just to ask people to please stay on mute unless you're speaking, so that all of us can hear. And feel free to chat me your questions. Let me know if you'd like to ask your question yourself, or if you want me to ask it for you. I'm happy to do that. But I try to make this about asking your questions as much as possible. If you have a question that's sort of building on what we're talking about, you can use the raise your hand function, or just let me know in the chat that you want to ask a question. Feel free. I like other people to engage as much as possible, because again, we want this to be a dialogue and not a presentation. So I'll try to keep the flow going, but encourage you all to jump in with questions. And so before we dive in, I'm trying something new this month. I'm calling it my audience vital signs. And so I wanted to do a quick pulse check to see how much the group already knows about lupus. Okay, so I'm going to launch a poll. And I want people to fill out the poll to the best of their ability, just to get a sense of what people know about lupus already coming into this conversation. So I'm going to do that now, and I'll give folks about a minute to respond to these questions. All right. People see the poll? I think some people are making dinner. All right, I got a few responses. You didn't realize you guys were coming into a pop quiz. Yeah, well, so as Mandy said, once you scroll down, you can scroll down to finish the poll and we'll let you submit it. So there are 3 questions. All right, we'll give it about a minute. We got some good engagement. People are responding. All right, we're still going. All right. I'm going to stop the poll now. I'll share the results. So it looks like we're sort of, some all over the place a little bit with the first question about how many people in the US are living with lupus. Most common answer was 1.5 million. And then which group is most likely to get lupus? The majority of people selected women of color, non-white, in the middle age, childbearing range. Okay, and then are COVID-19 vaccines currently recommended for patients with lupus? And 88% of people say yes. All right, and so we'll make sure that we address all of those questions for sure tonight. But it's really helpful just to get a sense of what people come into the conversation knowing and what they don't know already, and we're here to learn. So, okay, that was fun. And then the last poll before we jump into the conversation I wanted to do is to do what I'm calling the temperature check. So I'm going to do that one now. And so this is a simpler one. Okay, not too many questions, just one question. Let's just get a sense of how the audience is feeling and what they care about focusing on. So I am most fired up to discuss and learn more about, and just select one. All right, most people voted. Give it a few more seconds. All right. Share the results. All over the place a little bit. It's good. So people want to learn about a variety of things and talk about a variety of things, all elements of this. So I'm going to go a little bit with the last one here, sort of I'm game for whatever. Let's talk about all of it. And so we will try to hit on all these topics. And so I'll try to do my best to sort of keep the conversation moving along so that we get to as much of it as possible. Okay. Without further ado, I just want to take some time just to introduce we have 4 really awesome panelists with us tonight. And I'm really grateful for these folks for coming out and spending some time with us on Thursday evening, and just introduce them by name. So Candace Feldman is a colleague of mine, a friend of mine from the Brigham. She's a physician. She's a practicing rheumatologist and focuses a lot on lupus, obviously, but thinking a lot about racial and ethnic and socioeconomic health disparities in rheumatic diseases. And Jess Williams was a former colleague in residency of mine and is now a rheumatology fellow at the Brigham. And she also, spends a lot of time researching sort of the environmental risk factors for lupus, some of the neurologic manifestations of lupus, and how to increase African-American participation in lupus clinical trials specifically. And then Dr. Karen Costenbader is the director of the Lupus Program at the Brigham. And so really appreciate having some of her time tonight. And Gail Granville is the director of the Women of Courage Lupus Support Group. And so Women of Courage, I'm gonna let Gail talk a little bit about Women of Courage later on tonight, but it's a grassroots organization managed by lupus patients and family members and volunteers who are really dedicated to improving the quality of life for those affected with lupus. Jen, yes, you're gonna get the recording, I promise. I'll share it with you at the end of this. This is being recorded for those who want to view it afterwards. Okay, awesome. So these are amazing guests to have with us tonight, and really cover sort of the full spectrum of how to thinking about lupus and thinking about disparities in lupus care and how to advance advocacy for lupus as well. And so I thought what we would do is just to sort of set the baseline is like think about lupus and like what do people need to know about lupus, just like as a condition itself, and maybe starting out with like what is lupus, and like more broadly like what is autoimmune condition, like what is an autoimmune disease more broadly. And Jess, maybe I'll start with you. Maybe just to answer that for folks, just how to think about it, because I remember always being like confused about autoimmune diseases, and they always seemed like kind of weird to me when I was going through my training.
Absolutely. So hi, everybody. As Rich mentioned, I'm Jessica. I am a rheumatology fellow at the Brigham, finishing up my training next month, actually, and excited to this soon. Very excited to be with you all. So autoimmune diseases, there are a wide variety of autoimmune diseases. And basically what's going on in them is that your immune system, which is supposed to help you fight off infection, is now recognizing parts of your own body as foreign and sort of attacking those different parts of the body. And so there can be autoimmune diseases that just affect one organ system, or diseases such as lupus that can affect many different organ systems in the body. And so lupus is one example, but that we can think about are rheumatoid arthritis, which typically affects the joints, but can also affect some other systems in the body. We can also think about things like Crohn's disease or inflammatory bowel diseases, which affects the joints as well as other parts of the body. Multiple sclerosis, if you all have heard of that, is also an autoimmune disease. Type 1 diabetes. So as you can see, there are many different ones that are out there.
That's great. And so it sounds like the common factor is like the body is recognizing itself as foreign. And I don't know, like, Karen, maybe you could talk a little about why that happens from sort of like a high level and just sort of break it down. I know it's complex biology, but like, why does that happen? Do we know why that happens?
That's I'm putting you on the spot.
I know.
That's a very good question. I wish we knew exactly why that happened. We don't know exactly why that happens. And as Jessica was just saying, there are many different kinds of autoimmune diseases. And I mean, I've been interested in these questions of why do people get autoimmune diseases in the first place? What are the risk factors we can identify? Who is more prone to getting them? And then, we still are very bad at knowing what organ will be affected, whether it's in lupus, because it can affect many different organs. But basically, the immune system is very complicated. It has two branches, let's call them the innate branch and the adaptive branch. And we don't know we know there are many problems in some people in the innate branch, the oldest part of the immune system, and there are some in the adaptive part, which are the autoantibodies. In lupus, there are a lot of autoantibodies in particular. So antibodies that you would have after you have an infection, they might start attacking your organs. Why this happens, we don't know. It can affect your blood cells, your heart, your pancreas, and many joints, rashes, all these things. And the way we treat lupus is really to dampen down the entire immune system, unfortunately. We're getting better, and maybe we'll talk about later, like new smart medications are being developed for lupus to just take out one part of the adaptive immune system, like the B cells that are making autoantibodies, and to target them instead of making people really immunosuppressed.
And I know you do a lot of work thinking about sort of, and we'll get a little bit into some environmental exposures, because I know a lot of people are interested in that. We got a question in the chat around, early childhood trauma. Like, can that be a factor in people getting lupus? And maybe just like even stepping back to think about like, what do we know about what could cause lupus?
Yeah, and Candace can speak to this too, because she's worked with me and we put together on studies. But so we don't know what goes wrong with the immune system, really. But we do know that these are complex diseases, that there are genetic factors that you inherit from your parents. So you have a genetic predisposition, you may be at a little bit more risk. And then during your lifetime, you're exposed to different environmental factors. So a lot of our work has been trying to identify those environmental factors and see if anything is modifiable, like we could actually stop it. If we could identify who's at risk, maybe we could prevent the development. So we've looked at many different risk factors over the years, and smoking increases the risk and obesity increases the risk. These are studies in the Nurses' Health Study, which is a big cohort of nurses across the country since 1976. And we've worked in the Black Women's Health Study as well. And other cohort studies of big populations of women, mainly women get lupus. Other things that are related to, Jessica's written about pesticide exposure, and Candace and I worked on a study about exactly that, childhood adverse experiences and child abuse and post-traumatic stress disorders also associated, and depression. So we don't know exactly what is in common, or maybe there are different pathways by which maybe there are different combinations of genetics and environment that lead to lupus, or maybe it's really a pathway that involves stress on the system, a lot of stress, either through smoking or obesity or childhood trauma or all of the above. And then in people who have a genetic predisposition, something goes awry with the immune system.
Got it.
So that's about where we are in understanding it.
Yeah, it sounds like it's complex, and obviously I think that like many of us have heard like this idea of like inflammation, right? And like stress causes inflammation, and that leads to a bunch of bad stuff for a lot of people. And so, and I want to ask this question in the chat too to Candace. I don't know if you have any thoughts about fibromyalgia and whether or not that's something that also sort of falls into this category of autoimmune diseases.
Sure. So I can say it's not entirely my expertise, but I think fibromyalgia is a disease we really don't know very much about. We think that we tend to see that it can run with autoimmune diseases. So it is it is not uncommon for patients of ours with lupus, with rheumatoid arthritis, with osteoarthritis to also have fibromyalgia. We tend to not, at this point, think of it in the same way as an autoimmune disease that we can test certain blood tests and see antibodies that are positive that would be suggestive of it. So I think I think at this point we think it is a bit different and not really an autoimmune disease the way we think of our traditional autoimmune diseases. But I think we have a lot of work to do to understand it a bit better, and to understand also why people who have lupus and other autoimmune diseases tend to seem to have an increased risk of having fibromyalgia as well. And I saw another question in the chat from somebody who clearly knows a lot about these topics too, and about the question of following ACE, so adverse childhood experience surveys. And I will tell you, we personally have not collected these data in our patients. However, there are a few studies out there that have, and they've shown associations between high scores or having adverse childhood experiences and having increased lupus disease severity. And I recently heard a talk where someone was talking about ACE levels in childhood trauma and finding an association with lupus disease severity and activity, but then seeing the subset of patients who had adverse childhood experiences who then had adult trauma. And it seemed like the adult trauma really trumped the adverse childhood trauma when it came to leading to increased risk of of disease severity and activity. So I think for sure, as Karen said, stress and severe stress really at any point in a person's life, whether it's during childhood or later, and particularly people who unfortunately experience both, I think that certainly can increase both risk of the disease and also risk of having worse disease.
Boy. Well, that's great. I think that like these conversations are always humbling because I think we always come out like there's just so much we don't know in medicine, I guess. And like, I think people look at us to be like the experts and they're like, we're still trying to figure this out just as much as you are in so many ways. And I think, it's particularly true, I think, with autoimmune conditions in many ways. And Gail, I was hoping, one of the questions I asked in the poll was just around how common is lupus? And I don't know if you could shed some light on that for folks, just like how many people are struggling with this condition here in the US specifically?
I'm sorry, this is Gail. Are you asking me?
Yeah, I'm asking you about just like, prevalence and how many people are struggling with lupus.
Well, the view that we've taken at it, and one of the questions I was going to ask, previously, lupus was sort of like titled a rare disease. Gone away from that because for myself, I know so many people that have autoimmune diseases. In my family alone, we have the lupus, we've had scleroderma, we have MS, we have rheumatoid arthritis, and the list goes on and on. And but I always thought that in the United States there were around 1 million or so that have received a definitive diagnosis.
Yeah.
But in my own community, the numbers go off the hook.
That's a great question. So I think, to your point, it's around 1.5 million is sort of like the estimate, and that was in the poll that I asked. But I am curious from either Jess, Karen, or Candace, like the prevalence of autoimmune conditions generally, like is first of all, is lupus, I mean, to Gail's question, like a rare condition now? Would you classify it that way? And just like autoimmune diseases in general, like are they increasing in prevalence now, or are we just detecting them more for people? Like any and all to hop onto that one.
So those are also really good questions, and I think it's been a controversy. And we talk about lupus and we talk about systemic lupus, erythematosus, and we use them interchangeably. But really, I think that lupus is a big umbrella, and there are many different autoimmune diseases that are very similar to lupus or related to lupus or have features of lupus, but maybe not all of lupus. There's some people who only have skin involvement, for example. And they have cutaneous lupus. So there's a difference of opinion. So the Lupus Foundation of America, and I'm very involved with them, their number is 1.5 million, and they did a big survey, and they say that 1.5 million Americans are living with lupus, and that's probably the umbrella large. And then maybe smaller, there have been studies funded by this CDC recently, and they have much smaller number because they did studies differently. So these studies trying to figure out the incidence, new cases, and the prevalence, how common these autoimmune diseases are in the population, always have biases and are hard because we also think that some people don't get diagnoses, don't get to attention, or are misdiagnosed. And it depends on where you look. So the CDC only looked at, used very strict criteria and went through medical records, and you had to meet all the criteria in the formal records versus, having been told by a doctor that you have lupus is probably the other end of the extreme. So it's hard to pin down. I'm interested in whether lupus will increase or lupus symptoms probably after this whole horrible COVID pandemic we've been through, and everybody's been under enormous amounts of stress. And people who are predisposed to get autoimmune diseases, we can only think that the numbers are going to go up. But right now, hopefully people are getting more access to medical care, but there's also been people who haven't even had access to medical care. So there are lots of different factors as well.
Yeah,
I would also say to Gail's point too, if I can interject too, I think that you know, I think Gail's exactly right. You know, we definitely do see like clusters within families. You know, I can say I take care of a number of patients who I take care of, you know, 6 members of their family, all of whom have autoimmune disease. And I think, you know, I sort of second what Karen said too, that, you know, we know that there is on average a 6-year lag between when people develop symptoms of lupus and when they actually get a diagnosis. And, you know, I've learned from many of my patients and many members of Women of Courage that oftentimes it's way longer than 6 years. And so, you know, I think it's true, you know, whether it's rising or whether we're detecting it, or maybe we're better at getting sort of word out about the symptoms so people come earlier to get care. I suspect that as awareness increases, probably the prevalence is going to increase as well.
Sure.
Just have one more thing to add about it. I agree with everyone. And I would also say the prevalence of lupus is going to be much higher in certain groups of people. It depends on which population you're looking at, because if we're looking at all comers in the US, you know, that's one thing. But if you're looking at women, non-white women of childbearing age, the prevalence is going to be much higher. And I know that was one of your polling questions.
Yeah, that's a great segue into my next question.
Yeah, and so we know that patients living with lupus, 90% are female, 10% are male. We know that people, the most common times for people to get lupus is between the ages of 15 to 45. So when people are really in their reproductive years. And then we also know that all non-white populations actually have higher rates of lupus than white individuals. And so, you know, why is this the case? As far as the gender disparities, we think that female hormones play a role in this. For example, if you have very active lupus, we tell patients who have active lupus that they should not be taking estrogen-containing birth control, for example, because it can exacerbate the disease. As far as, you know, why is lupus more prevalent in non-white populations, we don't know the answer to that. There probably is maybe some genetic reason, but there probably likely is environmental reason as well, and possibly what non-white individuals are being exposed to in this country is potentially leading to that higher rate.
For sure, and I want to dig into that a little bit more in a minute, but I guess, you know, stepping back, given the fact that it does affect women of childbearing age so much more than it does any other group, like are there considerations around lupus in pregnancy and complications from pregnancy? Jess, maybe you can take that.
Yes, definitely. So, so I will say, you know, patients with lupus can have safe pregnancies, but what we want to happen is we want to get the disease as well controlled as possible prior to getting pregnant. And we want to make sure that patients who have lupus are not taking any medications that would be incompatible with pregnancy, that would, you know, potentially lead to miscarriage or to problems with the baby. So those are some of the main things that we are concerned about for women with lupus who are getting pregnant, getting their disease under control and making sure their medications are compatible with pregnancy. There is an increased risk of pregnancy complications for patients with lupus. And so it's very important for patients with lupus to be managed by a special GYN doctor who can help them navigate that through pregnancy.
Yeah. And I think, you know, before we go on and talk about some of the other sort of causes or like even the disparities in lupus care, I think it might be helpful for those who are here and maybe, you know, didn't know as much about lupus to start, or, you know, maybe don't have family members or loved ones who have lupus, like to maybe paint a picture of what lupus actually looks like for maybe some of the patients that you take care of. And I think that I always thought about lupus when I was in training as like, you know, sort of called the invisible illness in certain ways, because it can show up in so many different ways and go undetected for so long. And so maybe, you know, each of you maybe could just give an example of what lupus looks like in sort of the clinic where you work and who you take care of.
Sure, I'm happy to start, and I want Gail to also weigh in too.
Please.
From all of her experiences too of talking to people with lupus and the like. So I think, you know, one of the things that we know is that no two people with lupus look exactly alike when it comes to the symptoms that they may have, the lab tests they may have, how they respond to certain medications, and what the course of their disease over their life looks like. So I think, you know, that it tends to be not predictable and not sort of out of what we call like a textbook, right? So I have some patients who have some joint pain that comes and goes, that have rashes on their faces and other parts of their body, who are very sensitive to the sun at times. And I have other patients who have inflammation around their heart, inflammation in their stomach, and who have kidney disease, increased risk of blood clots. And I will say that one of the unifying features of most of my patients who have lupus is fatigue, a sense of feeling very tired. And a lot of the medications that we use are pretty good at treating the skin and pretty good at treating the joints and good at treating the kidneys, but they're not so good at treating the fatigue. And so if there's one symptom that I would say that is sort of a unifying factor from people who have mild disease all the way to people who have very severe disease, which I would classify as involving an organ like the kidney, it is that fatigue.
Gail, do you want to chime in? Yeah, Gail,
Okay.
please.
The only way that I can really, from my own personal experience, is I have to look at every day as being my new normal, because each day when I wake up, I really do not know what to expect. Sometimes I can get up at it, sometimes I can't. The fatigue has been a big issue with me. But for the most part, I think the biggest issue I had with the lupus is the aspect of how your mental health is involved with it. I know as a child, many of the doctors felt that it was more of a psychological issue than a physical or biological factor that should have been looked at. It took well over 30 years for me to finally get a diagnosis. And the only reason I got a diagnosis was because my sister had passed away at a very early age from scleroderma. Then the doctors were able to see that there might be something there. And that's how I finally got my diagnosis.
Yeah, that's a horrible story. And I think that taking care of lupus patients over the years is maybe, as a doctor, very humble, because it's a systemic disease and it can look like anything. And I think that's why there are the delays in diagnosis. As Candace said, one of the unifying things is that people have, all of these proteins, these cytokines are upregulated. There's lots of inflammation going on, which makes people feel horribly tired, like when they have the flu. But that could be an infection, that could be a cancer, that could be so many other things. And then lupus can attack any organ system. So once it is diagnosed, you never know what shoe's going to drop next. Is it, in general, people who've had kidney involvement may have more kidney involvement, but sometimes they've had kidney involvement and then they have nervous system involvement out of the blue. So it's a systemic disease that it can affect any organ. No two patients are the same, although they have a lot in common. And our therapies really to date are very heavy-handed. As I was saying, we take down the entire immune system. So we've got to do better, and hopefully in the future we will be able to target them. If you have kidney involvement, maybe we don't have to take your entire immune system out. We can really just deal with that.
Makes sense. Jess, you want to add in on this?
Absolutely. So I agree with everything that was said, and I would also just reiterate that it's just there's such a wide variety of presentations that I see in patients with lupus. For example, there are patients who have very, very mild disease. Maybe they have some sensitivity to the sun and they may have a little bit of joint pain, but it's well controlled with Plaquenil, one of our main drugs that we use for lupus. And then I've seen patients who come into the emergency room and are in kidney failure, and they have fluid around their heart, and their heart's not able to squeeze well, and they may have very low blood count, so more on the life-threatening side of things. And one thing that I always tell my patients with lupus is if they have any new symptoms, anything that's concerning to them, to reach out to me, because it can affect so many different parts of the body. There was a question in the chat about neuropathy. I think somebody asked whether that with lupus, and an example of this is I saw a patient in the hospital earlier this year who came in and basically she wasn't able to move one of her eyes. She wasn't able to look to the side, and she actually had lupus affecting one of the nerves that was leading to her eye muscles. So, you know, to answer that question, neuropathy can be, and nerve involvement can be a symptom of lupus. And also piggybacking on that, someone asked about multiple sclerosis, is it an autoimmune disease? And so we do consider it to be an autoimmune disease. We haven't identified what exactly the immune system is attacking in multiple sclerosis, but the evidence that we have points to the fact that it's immune mediated condition.
Totally. That's very helpful. So I think that, like, and I remember this too, it's like, you know, autoimmune conditions, so many of them can affect so many different parts of the body and sort of masquerade in a lot of ways. And as a doctor, sometimes that's not the first thing you're thinking of, right? There are maybe more common things to think of, or more immediate things that you're just like sort of trained to think of. And so that's why it can go for a while before people get a diagnosis, which is, I imagine, like very frustrating, especially if you're living with crippling fatigue and no one can really figure out why. But it does sound like, and what you're saying is like, it can range very drastically in terms of how mild to severe it is, and that it could even be life-threatening. And maybe you guys, I mean, just sort of touching a little bit more on like on the severity there, like how does it get life-threatening, I guess?
Yeah, so there are people who, you know, their first presentation, you know, right when they develop the condition, it can present that way, meaning it's not like they ignored the symptoms for years and then it showed up. It's just that that's how they presented with severe disease. And then other times it could be, you know, potentially that there were delays in getting to care that could have led them to have a more severe presentation.
Okay. And are these like, are the symptoms, are they permanent? Or it sounds like sometimes they like come and they go, or
yeah. So, well, I can also let someone.
No, go. I mean, you're on a roll. Go.
Okay. Yeah. So lupus, it tends to be sort of a waxing and waning. People go through periods where they have no symptoms, and then they can go through what we call flares, where their lupus is very active. So that's pretty common that people will have intermittent symptoms in lupus. And as far as symptoms being permanent, you know, I would say no. We do have, you know, effective treatments for lupus as well. So people, for example, the patients that I talked about that presented with low blood counts, kidney involvement, and fluid around the heart, we were able to treat those problems, and they're now doing quite well.
We're going to get to treatments, because I like to make sure that we always end on somewhat a positive note. We paint this grim picture. Candace, you want to go?
No, I was just going to say, you know, I think I agree with everything Jessica said. I think the one key piece to many of those things is to getting care early. And, you know, when things are not reversible is when that doesn't happen. So, you know, if we can detect early inflammation in the kidney and treat it really aggressively and really early, the outcomes are really good. But if we don't find it and it's not tested and we don't see the person and they come in kidney failure, the chance of us being able to reverse that becomes a lot lower. So I think, you know, for me, you know, if I hear about things and I can test for things and I can treat for things and find them early, then I think that the chance of reversibility is really good. But, you know, that it's a good reason to making sure that people get care early and consistently.
One of the questions I just got in the chat that I thought was actually really good and should have asked is lupus contagious? And I think that we're in a period of contagion with COVID, and so I think it's a very relevant and important question. Karen, shaking your head.
Lupus is not contagious. No.
Okay.
No. So you know, as I said, I think you inherit from your parents some kind of predisposition. You're more at risk for it. We don't know exactly a combination of genes. And then there's an environmental exposure, but it's not an environmental exposure from the person next to you. So it's not a germ we don't think that you're going to get from someone else, and you're not going to give it to someone else. It does run in families, probably because of underlying genetics and exposures, but it's not itself in any way. You know, I would have gotten it long ago because I've seen a lot of patients.
True. You would have. Oh, and Candace, thank you for letting me. Cynthia, I guess yeah, Cynthia was raising her hand. And Cynthia, I don't know if you're there and you want to ask. Oh,
yes, I'm here.
Oh, here you are. Perfect. Jump in.
Here's what I want to say.
For sure.
In terms of lupus, my first exposure with lupus was in New York, and this is in the 80s when AIDS was very prevalent. Lupus first, and I literally had like lesions on my face. And it was such a severe case because we had all the lesions, suntan, and that threw us some earpiece.
Well, you're fading out a little bit. Can you bring the microphone closer to your? There you go.
And you know, it was my
better.
I had lesions all over my face, and it was so severe. I mean, intravenously or pill form. And I had
I think your audio is like a little bit. It's a little bit.
How do I fix the audio?
It's like it's going in and out a little bit. So I like hear you sometimes and other times not as well.
So how do I fix that?
Good question.
I mean, I turned my volume up.
Now we hear you.
Now we hear you.
So in terms of lupus, again.
There you go. Go again.
Once again, my was destroyed. And it was so bad I had to have a liver biopsy. This was all in New York. And then systemic, like maybe a year later. Bellevue, and that wasn't working for me.
Got it.
So that's why I came to Boston.
Good. Well, thanks for sharing that with me. I think I got most of it, but it sounds like you went through your own really tough journey. Yeah, it sounds like it was and not getting the right diagnosis for a little while and really struggling. And I think you're speaking for a lot of people who probably have experienced that too and are struggling with lupus. So I appreciate you sharing. Thank you.
Yeah, and I'm sure you're not the only person, especially skin lupus, as you were saying, the discoid lesions and other kinds of lupus can cause all kinds of different rashes, and they can be very disfiguring, and that can really be difficult for people. So we have excellent dermatologists that we work with, but these lesions are a challenge, and I can imagine that having people think that you had some contagious disease like AIDS back then.
Their daughter had AIDS.
Hard, yeah, really hard. And people
can be really nasty.
No.
Yeah.
Really
Again.
harsh.
My legs. They biopsied me to death.
Mm.
Yeah. And sometimes they're in the scalp, and then you lose your hair, and it can be very challenging, very very difficult to live with.
And maybe, go for it. Yeah, please chime in.
Yes, I just had a question. Does alopecia have anything to do with lupus?
Yeah, so that's alopecia is hair loss. Yeah, and you can get hair loss
because I was just diagnosed with that.
Yeah, you can get alopecia hair loss from many different conditions, but lupus, especially active lupus, is associated with hair loss, like really big clumps of hair just falling out. Or as we were saying, the discoid lesions or other kinds of rashes in the scalp can lead to hair loss as well. But it definitely goes together. And there are some experts that really think about how to treat alopecia and lupus alopecia, but it's also difficult.
Yes.
And I think maybe to Cynthia's point and what she sort of raised in that, what she brought up with her stories, maybe talking a little bit about the connection between lupus and just sort of chronic conditions, maybe in general, and mental health. And is that something that you guys focus on a lot with the patients that you take care of with lupus? And maybe how does the sort of care team deal with that?
They already put me in the mental hospital.
Yeah,
I already had life experience.
Yes, I want to hear how they, like, I'm sure it's an issue for you, Cynthia, but I'm sure it's been an issue for many people who are dealing with this. So Candace, go for it.
Sure. So, I think that, you know, one of the things that we know is that lupus can definitely contribute to mental illness, depression, anxiety, and other symptoms too, including psychosis is something that we can see in lupus, and also from some of the medications that we use for lupus. But depression is incredibly common. You know, Karen was alluding to a study that she had led that showed an association actually with having depression and having an increased risk of developing lupus. And we certainly know in studies our group has done and others that, you know, having depression can increase disease severity, can increase the risk of not being able to take your medications as prescribed, can increase your kind of outlook on your illness, your ability to self-care, you know, to manage your illness. And, you know, I think, you know, in the perfect world, we would have a social worker or a psychologist or a psychiatrist just embedded within our clinic, in our team. There are all sorts of politics that make that challenging, but it's certainly something that we as a lupus center have been trying for a lot of years. And we definitely have go-to mental health providers that know us and our patients very well. And I think sort of working as a team in that respect is really important. And I think that in many patients too, these feelings go undiagnosed and certainly untreated. And I think if we can ask more about it, recognize it, acknowledge it, then we can also do better in treating it.
For sure. We want to add on to that. I had this interesting article I found about, actually, I'm going to put it in the chat. It was actually it was Snoop Dogg's daughter who has lupus and talked about her struggles with suicidal ideation pretty recently, and sort of like made a bunch of headlines. And so, yeah, I just wanted to put that there for people to check out and read. Karen, go for it.
No, thanks. I think that you know, Snoop Dogg being such a public figure brings these problems to light, and I think that lupus is associated with high risks of depression, anxiety, and other mental illness. And it also, I mean, during the pandemic, like, access to mental health, even for us, and we are at an excellent medical center, is difficult, and it shouldn't be so. It shouldn't be so difficult. It shouldn't be so difficult for us to get excellent mental health care for our patients to access. We just, in the country, I don't think we have the enough infrastructure, and lupus patients really need excellent mental health resources around them. So we're trying to advocate all the time for our patients, but it's an uphill struggle. I think we just don't have enough in the community. We don't have enough at the hospital. We don't have enough everywhere.
Yeah, Gail. Yeah, I was actually wanted to come to Gail on that point, because I think that like there's so much power in like support groups and community for actually helping people go through their, you know, deal with their struggles. And I think sometimes like especially in Boston, we're like, oh, the healthcare system needs to handle all this and we can take care of it. And so I wonder, Gail, like what your reaction to that is, and what you've seen, you know, patients with lupus, how the benefit they've gotten from being in a support group. Maybe you can talk on that.
And that's what I was going to touch upon. In my opinion, and personally, the support groups have been a lifeline for me. Okay, and people. One of the things that I really want to know is, what I think people should know, why they should join a support group. And some of the things that I have noted down is that, you know, if you don't truly understand the nature of lupus, of what you're going through, and you don't know what to expect, you can garner so much support and understanding of what the disease could bring into your life by belonging to a support group. You know, and if you're feeling isolated and alone, can really be a vicious circle for you, and actually cause more harm if you don't deal with those two issues, the loneliness and the isolation. Oftentimes, a patient will isolate themselves from other people because of their condition. And that in turn really can have a very negative impact on your overall health. And also, many people do join a support group because they cannot afford the cost of seeing a psychiatrist or a counselor or a therapist. So I look at a support group as being a supplement to those services. And especially if you're really feeling hopeless and helpless and you're in denial about your illness and stuff, the people that you meet within the support groups is living proof that you can live a full life. Many of our members have had wonderful careers, families, and all of that. And we sort of like validate that life will go on. You probably just need help with management and having people that in your life that understand exactly what you go through, during any particular day. So, and not only that, I think when you're in a group with people that are dealing with the same health issues that you have, you're being held accountable as far as self-care, medication adherence, and things of that nature.
Yeah, that's wonderful. And I'm so glad you were able to speak to that. I'm going to put a link in the chat. Oops, where did I go? To people for, we'll compose a resource guide for folks at the end of this discussion. We'll post this on the website as well. But here are just two helpful links, I think, to support groups for lupus. So thank you, Gail, for sharing. And so before Chisa, I want you to ask your question. If you're here, I want you to go first, and then I'm going to take a little temperature poll. So go ahead, Chisa.
I wanted to ask, with regards to what we're talking about, the mental health, where is the line drawn between the loneliness that comes from having a chronic disease like lupus? And when does it now cross over to mental health issues in terms of depression and clinical issues? So how do, because I think of a lot of patients that I deal with, where is that line between just pity, stress, loneliness, frustration, and all that, and sadness? Then when does it cross over? How do you distinguish where that line is?
That's a great question. It's a good question. I mean, I'll answer as a primary care doctor. I think it's even a good question just generally for general people, right? In terms of all of us experience isolation and loneliness, and especially now in COVID times, even worse, right? And so how do you guys, or how do you have your radar up, I guess, for people when okay, this person needs more advanced sort of mental health support? Or how do you think about that?
Well, I don't know if it's a question for us, but I think that Chisa is totally right. And Rich just said, it's a spectrum. And I think we all, especially in the past year, we've all been isolated and down and sad. And then if you have a chronic disease like lupus, you've been struggling with it for a long time. And then, our moods fluctuate day by day. And some people are more resistant or resilient than others, and other people are more down. But I think for me, we do try to ask some questions when I see people about, get a sense, as you said, the temperature of where they are, and have they been having recurrent thoughts every day? Are they really down? Are they crying a lot? Those kind of questions. Are they thinking about hurting themselves? Or do they, really, and then trying to figure out where we can get some mental health problems. But as you said, everybody's been dealing with this in the past years, and people with lupus for longer. And sometimes it's hard to know where they are on the spectrum, because a day with a lot of fatigue and a lot of symptoms might be different than another day. But there are some screening tests that we can do in the office to ask about the severity. I'm not sure they're 100%, but.
No, I think it's a great question, and one that we're I think always grappling with, especially as we, you know, do medicalize a lot of things and like trying to figure out where that line is. So thank you, Chisa. So
I would just add one thing too, which is that, you know, I think oftentimes people live with a lot and they suffer a lot for a really, really long time because they feel like, oh, well, of course, this is, you know, normal. I, you know, have this chronic illness and, you know, this is just what it is. And I think, you know, one of the things that we as physicians should be doing better at is you know, encouraging people to seek some help sooner than, you know, sort of waiting until you have the highest score on one of our severe, you know, severity measures, you know, to sort of say, listen, you know, maybe talking to an expert would help, you know, maybe there is a medication at a low dose that could take the edge off of this and, you know, help your ability to cope. And, you know, or maybe it's just having somebody that's not a family member, that's not a close friend who, you know, is sort of separated enough from you that person would be helpful to sort of listen. So I think that, you know, the standard way that we kind of go through that, you know, this is sort of a feeling that you're having versus this is crossing that line of, you know, what we would call a mental illness. I think it's just so hard to define. You know, we tend to think about severity, we think about duration, you know, is this something that you're experiencing every day for a month? You know, that's, you know, and has that been going on and on and on? You know, I think that if we had better services in our country, we would, you know, not use a month, we'd use 2 weeks, right? And, you know, I think the challenges during a pandemic, you know, the responses are, you know, yes to everything because there's just so much isolation and loneliness and that breeds more depression. But, you know, I think that the sort of imperfect answer is, I think it's a spectrum, but I think it's really personal and individual. And I think that we should really be screening more and thinking about connecting people with help sooner than we do.
And maybe Candace, while you're here, because I did want to transition a little bit to talking about disparities in lupus care. I know we've touched on this a little bit, but I know you think a lot about this. I know Jess thinks a lot about this, obviously. Yeah, maybe just talk about like the lack of access to care and how that impacts folks who have lupus, especially since it is so much more prevalent in African American women in particular, and what you guys see both like from like, you know, the research that you do obviously, but then also just like, you know, stories from the clinical world.
Sure. So I think, you know, one of the things that we've found and others have found as well is that, you know, we know that the disease is more prevalent among African American individuals, among Hispanic individuals, among American Indian, Alaska Native individuals. And but what we also know is that the outcomes tend to be worse and access to high quality care tends to be poorer and access to preventive care tends to be poorer. And prescriptions of some of the sort of standard of care medications tend to be less for in some cases. So, you know, I think when we think about disparities, at least the way I like to think about disparities is that, you know, as Karen mentioned earlier, what's modifiable? Like what can we do to fix an imperfect system? What can we do to fix a country that's plagued by structural racism? You know, what can we do as healthcare doctors to providers to sort of chip away at some of those factors and make sure that, you know, if there are vaccines that we know work well in patients with lupus, to make sure that no matter what race, ethnicity, insurance status, language you speak, that you have the same access and ability to get that as everyone else. And, you know, with the hope that downstream, those disparities we see in who gets severe infections and who gets hospitalized from infections and then who dies from infections, that we'll reduce that disparity. So, you know, I think that, you know, one big thing for us is thinking about what's preventable and how can we improve screening, how can we improve, you know, treatments and prevention strategies in order to reduce the sort of downstream disparities we see.
Maybe while you're talking about that, like maybe just explaining to folks, and we've heard a lot about vaccines recently, obviously, and we can touch on COVID as well, but like, why are people who have lupus more at risk for infection? I guess is one of the questions that I have. And like, so, because I know you think a lot about how do we get people vaccinated, how we take a like preventive approach to make sure that they don't get infections, and why do they get more infections?
So probably the highest risk for infection among patients with lupus are the medications that we use to treat it. So medications like prednisone, steroid medicines certainly increase the risk of infection. And then other medicines that suppress the immune system, so others that we use like azathioprine, mycophenolate mofetil, or Celsep, rituximab, Cytoxan, all reduce the body's immune system, ability for the immune system to fight infection. We do know that people with lupus who are not on these medications may also have a bit of an increased risk for infection too, probably in some way because of this dysregulation of the immune system. But I think really the biggest risk for patients with lupus, I think, is related to some of the medications that we use to treat it.
Yeah, I mean, it's an interesting thing. I always think of like biology as such a balance in so many ways, and like the immune system's like that too. It's like, you know, it's like this little line where like if you give medications that target the immune system, it knocks it down, and then people get risk for infection. But if the immune system's overactive, then it causes, then you know, people get autoimmune conditions. And sort of like we're trying to find the middle balance a little bit with the immune system. And so, you know, maybe Karen, to your point earlier, talking a little bit about the current medications for lupus, and like, you know, you made the point of like sometimes they're like just big guns that sort of blast the entire immune system, and how you wish they could maybe be more targeted. So maybe we'll hear more about that.
Yeah, so there are a couple kinds of medications for lupus, and Jessica mentioned one of them. I think Jessica mentioned hydroxychloroquine, which is not immunosuppressive, so doesn't make you more likely to get infections. And we like that one a lot because it was actually a medication that was used for malaria. So as soon as someone is diagnosed with lupus, or even thinking it could be lupus or a related disease, we like to start them on hydroxychloroquine, Plaquenil. And it, of course, there's no free lunch, so it has its own risk factors, that it carries with it, but not of infections. So it can be associated with long-term a risk of eye damage or a risk of heart damage, but usually those are longer-term risks. And if you're followed, it's a pretty safe medication, and we like it a lot. You can take it during pregnancy. It is associated with, you know, really stabilizing those periods of flares, but you have to take it every day for a long time to get all the flares kind of dampened down. And then beyond Plaquenil, hydroxychloroquine, there are immunosuppressive medications, basically. So there's prednisone with, you know, steroid hormones that we use in the short term, and they work pretty well for lupus. They will work almost, you know, overnight. They work fast. We like that, and they have a ton of side effects. So we can't keep people on prednisone for a long time. So they can cause weight gain and diabetes and osteoporosis and infections, and the list goes on and on. But if we need something fast, as I just said, you know, the hydroxychloroquine you have to take for a few months to kind of dampen down the disease activity. But if you're really in a big flare of your lupus, we can't wait a couple months. So it's a short-term of prednisone. And then really the other medications we have, and the medications that are being developed, the new smarter medications, we call them steroid sparing immunosuppressives, because now really our goal in lupus is to get people onto a very stable regimen of their medications without using steroids, because we know steroids cause so many side effects. So these are medications like Candace was mentioning that do kind of blast the immune system as steroids do, and take down the entire immune hyperreactivity, overreaction. But there are medications like methotrexate and mycophenolate mofetil, Celsep, and azathioprine, belimumab, which is an injectable infusion medications, Cytoxan, which is an injection or infusion medication. So those are much bigger guns. But if they're followed, I mean, that's what our patients take. If patients are followed very closely for potential side effects, they do much better on those medications than on prednisone long-term. So we monitor the blood counts and the liver counts, and make sure that they have their vaccines to prevent infections, and they'll do much better keeping the disease under control with a steroid-sparing medication than with steroids.
Got it.
Over time.
No, that's helpful. That's helpful to know, and I think that, you know, yeah, I do medical weight management, so I deal with a lot of people who have weight issues because they've been on chronic steroids for so long, and so I think that people know, like, you know, there are obviously side effects of different meds that we use, but they are important. But I think, you know, Jen's question here is a good one about, you know, are there other complementary types of sort of more holistic approaches that may focus on nutrition or, physical activity and things like that, that also help to treat or at least manage lupus. And I know, Jess, I was going to turn it to you to see if you had any thoughts about that. And then I wanted to ask Gail the same question, just like maybe she'd learned some stuff through folks in support groups of what people find also helpful in addition to the medications that they're taking.
So there definitely are hospitals that are doing this. One example, Cleveland Clinic Rheumatology is actually looking into this lifestyle and wellness and how that impacts rheumatic diseases. And Jen, you bring up a great point. I mean, there are so many other factors to health other than taking medications. And some of the most important things that we can do for ourselves is get great sleep, exercise, and eat well. So I do think that those are all very important. And it is something that's being thought about more currently.
Sure. Gail, what's from your perspective? Please chime in.
I'd say our support group has been in existence since 1996. So many of us have known each other for 25 years. And having that extended family, making sure that a lupus patient is involved with social activities. One of the things that we used to do early on, we would take field trips, road trips. Things like taking an old train ride through New Hampshire, taking an old boat ride down the Connecticut River, and then ended up having a steak lunch. Just people having that connection and getting outside their day-to-day life gives them a boost. They're good for another couple of months because they've connected with people. They've been out for fresh air. One of the things that I try to really tell many of the women that we have dealt with is to have outside interest, or especially a hobby. So many of them don't have any outside activities or any personal interest. During COVID, I told them this is the time for you to do something that you've always wanted to try but haven't. I think by having these personal connections with each other really boost your general well-being, helps boost your self-esteem. It gives you a purpose other than just constantly thinking about your disease and your day-to-day struggles.
I love that. I think, to Jess's point of sleep, physical activity, proper food, to Gail's point around connection, purpose, like all those things may sound easy or simple, but obviously we know that they're not easy things to do, obviously, but how helpful that they are as part of a therapy plan, like a big therapy plan, right? Holistic one. So important. And so I wanted to, touch on, you mentioned COVID and sort of it's there. Everyone knows it's there. So how, Jess and Karen and Candace, like, what have you seen clinically in terms of how COVID has affected patients with lupus, and not even necessarily the disease itself, but you could talk about that, but even just like doing, virtual visits and telehealth and stuff like that. Like, how's it changed care for lupus patients? Is it for the better? Is it challenging? Like, I'd be curious to hear.
Oh, go ahead.
Simultaneous unmute. So I think I think we've all been challenged to find the silver lining and the positives in COVID. So there maybe have been a few that we made this incredibly fast switch to virtual visits. That the hospital and everybody have been telling us for years it was impossible to do that, and then overnight we had to do it, and it worked. And for for the patients that I know well and I've been seeing for a long time, it's been nice to kind of be in their home and get to know them and see their kids and their dog and etc. But it still doesn't replace an in-person visit, especially for physical findings. For, you know, if somebody has a swollen knee, I can't really see it very well on the camera. So there's that aspect. I think also for lupus patients, you know, we've all been talking about how immunosuppressed people are. So in addition to all the ambient anxiety and all of the fear out there, lupus patients have this other layer of fear about being immunosuppressed, and now hopefully we're coming to the end of it. We'll be vaccinated, and still it goes on. You know, they're at increased risk because they're immunosuppressed. What can they do? Can they even go out? And so it's been compounded for patients, I think, that have diseases that might put them at risk from COVID. And our medications are definitely in there. And then, you know, the unknown of even if they do get a vaccine, is it going to work because they're immunosuppressed? And we don't know. This is all happening so fast. We have some recommendations about holding medications to hopefully get the immune system, because in this case, we want the immune system to react to the vaccine to make an immune response, but we're, you know, suppressing the immune system with medications, or steroid-sparing medications and others, so that doesn't make an immune response. So now we don't know what to tell people, even if they've gotten the vaccine, if they're really going to be protected. So there's all this unknown and uncertainty out there, which is not the upside of COVID at all. And then, you know, people are actually getting COVID. Lupus patients, I think in the big studies, are not doing, you know, we were very worried about our lupus patients being immunosuppressed and having very bad outcomes. I think rheumatic disease patients in general and lupus patients are not faring much worse than other people. I think it's still the same comorbidities that put people at risk of being older, being obese, being smoking, having lung disease, having diabetes. All those things do put people at risk. And there are a couple of our medications that do put people at risk. One is rituximab, because it's very long acting. It's, you know, it's an infusion medication that you give, and it's in the system for 6 months. That looks to be associated with poor outcomes. Some of the other medications, if you get sick with COVID, you call your doctor immediately and you're told to stop the medication, but you can't do that with rituximab. So, and it's, you know, continues to suppress your immune system. And Candace has other stuff to say.
Yeah, I will say I'll take the optimist side of this, which is that, you know, anecdotally, I have had a number of patients who had COVID, and while several of them did get quite sick, knock on wood, everyone did okay. And I think that, as Karen said, you know, one of the things that I would say is good about, you know, a lot of patients with lupus is that they're really well connected with their health providers. And as soon as they have a symptom, they call. And so we're able to, you know, think about it and get them treated and stop meds we can stop. And, you know, now we're in a very different place in terms of even how we treat people with COVID, where we have the ability to give people what we call monoclonal antibodies, which we do now in anybody who, you know, is potentially eligible for that. So I think that, you know, if you do think you have symptoms of COVID, getting tested and getting evaluated early is really important, because we do have treatments now that really do seem to potentially have some effect to minimize the severity of the disease, and I mean of the virus. And, you know, I think in the big picture, as Karen said, you know, we do see probably a higher risk of hospitalization among our patients compared to patients without autoimmune diseases. But you know, the data were not admittedly as bad as we were nervous about for our patients. And so I think that you know, and I think that's in part a testament to how vigilant our patients are to, you know, to isolate, to wear masks, to wash their hands, to contact their doctor if they have any symptoms, to, you know, and the like. So I think, you know, I'm optimistic in a cautious way that, you know, as people continue the precautions they're doing and continue to stay in, you know, close contact with their physicians, that hopefully we'll also see a good turning point for patients with our diseases as well. Sure.
And just, you know, given that I'm just looking at the time, and I want to make sure we stay on time for 8:30, but I, you know, wanted to, you know, in the spirit of, you know, of sort of, you know, wrapping the conversation up, and given that it is Lupus Awareness Month, like, wanted to ask, each of you, if you had your magic wand to do what you could do to increase lupus advocacy and awareness, I'd be curious to hear what that looks like for each of you. And Jess, I want to obviously ask you to talk a little bit about clinical trials participation and just like really get just into the work that each of you are doing, in the clinic and also beyond. Would be great to hear.
Absolutely. So so Rich just touched on something that I've been very interested in and will be continuing to work on next year when I'm attending, and that's trying to increase patient participation in lupus clinical trials so that we can develop new treatments for lupus. And in particular, we know that patients of color are much more likely to develop lupus, but particularly Black patients are less likely to be enrolled in lupus clinical trials. So that's something that I think is really important. I think, there are many reasons behind why that's the case. One of the reasons is the history of medical research injustices in this country that were perpetrated against communities of color. For example, one that people frequently know about is the Tuskegee syphilis study. And so that's led to a lot of mistrust. And it's a really huge problem with lupus, given who the disease tends to affect. So if I could wave a magic wand, I would definitely want to work on this problem and see how we can get more patients enrolled so that everybody is benefiting from new treatments and so that we can make sure that new treatments work just as well in all patient populations.
It's a tough thing to figure out how to, I spent a lot of time talking about this around COVID and the vaccine trial for COVID too, of just like how important it is to get people from all swaths of life and different backgrounds and races and ages and stuff like that involved in these trials so that we can say like, this works for you and the group that you represent. Totally. Karen, I'll kick it over to you.
So I agree with Jessica. That's incredibly important. And I would like a very, very big wand to wave.
Granted.
I think our country, the world at this point, but has a lot of systemic problems that I wish we could. We've just kind of gone backwards. A political statement for the last administration that I hope we're going to go in the right direction. I think we talked about access to care. But we really need better access to care for every American. We need better health care, mental health care, all kinds of health care for every American. And there shouldn't be these barriers to care for people. I think we hear horrible stories about people not getting recognized as having lupus and other diseases and not getting into care for many, many years, that doctors don't know what to do with it, give people prednisone in the emergency room and send them out. We really have very fragmented, very uneven care across the country. Maybe we'll get to a better system of care that doesn't have, the embedded racism that we have in this country that I think does play a role in the kind of disparities in recognition of lupus and outcomes from lupus and many other diseases. So I need a really big wand to right a lot of problems in this country. And I know Candace is going to add more things to that list too.
Candace, you're up.
Yeah, so I'd like the same wands with Jessica and Karen. I think for me, just even looking at the names and the faces of people who are on this call, I think for me over the past, 12 years that I've had being here, I've learned so much from the partnerships that I've had with my patients, with Women of Courage, with support group leaders, with advocates who have lupus, and I think, and all autoimmune diseases. And I think that, we as physicians oftentimes get sort of siloed into our clinic rooms and our computers and our desks. And I think for me, one of the most powerful things that, I've had in my journey as a physician is sort of learning people's stories and realizing that, what you see when you meet a person for 20 minutes in an exam room really doesn't tell you anything about the person or their disease or what they're dealing with or how they're coping. And I think if I had sort of one wish for sort of advocacy and the way we do things is some way of sort of revolutionizing the way that we provide healthcare so that we get a much better sense of who our patients are and what they struggle with. Because I think if we really could understand those things, we could do a much better job. You know, I think that when we tell a person to take a medication with food and then they can't afford food, it's like, you know, and then we're like, why aren't you taking your medication? I mean, it's, you know, you realize that people come with so much. And if there was some way we could advocate to sort of understand those factors better, if we could learn more and if we had more resources to kind of help, and we recognize that, you know, as you know, somebody said in the chat, I think it was Jen, that, you know, health is holistic, right? It's not just cured by a medicine. And if we had a way of better understanding all of those factors and, you know, had a system that helped us address them, I think that would really make a difference to what we do.
That vision. I'm gonna order you guys some big ones. Gail, I want to hear from you too, please, around, you know, advocacy and awareness for lupus, and, you know, from your perspective as the patient and organizer of these groups, like, you know, how can we empower people who maybe have lupus to be advocates on behalf of each other?
It is really very difficult to get people to become engaged. But I think one of the things, if I had a wand, what I would like to see happen is that the stigma relating to autoimmune diseases, mental health, was totally removed. We still have so many women that have been diagnosed with an autoimmune disease that really has guilt about it. They still have the feelings of shame. So I think if we could remove those barriers, many more people that should be receiving care for autoimmune diseases will get the care.
Perfect.